Well, from years of training in the military and civilian side of the house, the adage, train as you fight, is always one that kind of comes to the surface. And being able to provide students with an atmosphere that's realistic and true to form is always critical. These products allow me to create injuries that are very, very realistic. It allows me to create injuries that are very, very efficient, and I can do these things very, very consistently time and time again. Some of the benefits of students being able to train with very realistic injuries is they have a very good impression of what the real life situation, or as much of the real life situation, could be. If you train folks in an environment that is artificial and completely fake, possibility is they may not get the desired outcome of the expected objective for the scenario or for a training scenario. Durability is a key for a variety of reasons. First and foremost, some scenarios might be hours long, some scenarios might last a whole day. And if a product is going to fall off after 5 minutes, well, then it's going to take a lot of time and effort to reset that particular injury or whatever it was that was not so durable. So durability is key. You want something that's going to be long lasting. You want something that's going to be very realistic and lasting a long time as well. Sure, versatility in a casualty simulation product is really important for a variety of reasons. The first is the environment. Some situations might call for being outside all day long. Other situations might call for more of a clinical situation for a very short period of time. And the product should be able to perform consistently and reliably in all of those sort of circumstances. In addition, it could also be the scenario calls for a human actor, and you want those products to be able to be used on the human actor or the mannequin.
They always say, train as you fight, and that is one of the most important tenets of any training, obviously. Now, nowhere is that more prevalent than in the medical field. Speaking from personal experience, I was an infantry soldier in the Army, and one time we had a roadside explosion that wounded several Marines, and wasn't my job, but I ended up treating them because the medic froze. All he could do was sit there and stare. No amount of prodding could get him to move. So I ended up treating him and other Marines on site. Training with high fidelity products or casualty simulation is extremely important. It eliminates that freeze. It gives your medics the ability to actually see and know what they're dealing with beforehand. So when they come across it in the field, and if they come across it in the field, there is no freeze. There is just, I've done this in training 100 times. I know exactly how this works. You know, it looks the exact same. In order to do that, you need to have high fidelity casualty simulation. You need to have something that looks, acts, responds real, feels real, because no matter how hard you try, you're always going to have that fake feeling, or if it doesn't look right, you're never gonna treat it as real. So if you have something that looks real, acts real, responds real, you're gonna treat it like it's real. The training exercises that we've done that involved high fidelity products are the ones that we take seriously. We treat them like they're real. We practice like we fight with those. Some of the other ones that we've done that haven't have been, I'm simulating pressure, okay, I'm simulating this, or I'm simulating that. That doesn't do anything except exercise my voice, you know? But when you actually have something to treat and have something to work with and go from start to finish, as opposed to, okay, yeah, you're good, we've transported you, you can go. You know, it works so much better. And it prepares you better, I should say.
While I was in the military was an early adopter of simulation. And in order to better meet the training needs of medics, moving from classroom to actual hands-on training, we developed simulation training. The military allowed me to effectively create scenarios and curriculum to train the 68 Whiskey medic. Casualty simulation arts, also known as Moulage, is important in the simulation environment because it increases the fidelity of the presentation to the medical provider. I believe that when you're training providers that don't have experience, providing them with a real-world experience in their own minds kind of like a clinical experience that they can tap into. So when they do get in these real environments, they have something to refer to. And it's been my experience that across the medical continuum, whether you're in academia or you're in the military, it's the people who have been there and done that they usually choose for the instructors. And it's because they have something to tap into as they're teaching. I believe that the materials that you use for casualty arts simulation are of paramount importance. I believe that if you cut your cost and go with cheaper products, number one, you don't get as high fidelity realism applied to your casualty. And number two, you're using a lot more of those products than you would with the better products. Specifically, at my company at PSSCG and also at Penn State College of Medicine, we use Graftobian products, which for me provide a more realistic to the eye experience when you're creating your injury simulations. And also, I have to use very little of that product. It goes a long way. So it's cost effective for me to use the Graftobian products as opposed to some of the other products that are out there on the market. Graftobian products produce a very realistic injury replication because of the high pigments that they use and the materials that they use to produce their products. Make the experience more realistic, from the blood products, which are very viscous and slippery as actual blood is, to the pigmentation colors that Graftobian uses in applying the makeup, bruising, and other simulated injuries. So it's been my experience in over the years of using the different products that Graftobian produces the best outcome for my injuries. Using realistic injury colors as they occur in real-life body traumas is one of the key elements in producing believable, real-to-the-eye results in casualty simulation arts. It is very important that the makeup color and application render high-fidelity results when applied to actors or patient simulators. The makeup must be true to the injury effect and hold up in continuity through repetitive motions and adverse environments. Most importantly, it should have the minimal need for reset or touch-ups that interrupt training time.
Graftobian created the perfect set of makeup coloring products that meets the rigorous demands of casualty simulation applied arts. Pro FX Rubber Mask Grease Cream, also known as RMG, and FX Air Airbrush Makeup. RMG is a highly pigmented makeup cream that is exceptionally versatile in use for full color coverage or transparent color washes, as you will see demonstrated in this video. FX Air Airbrush Makeup contains the highest micronized pigment in an alcohol hybrid formula that is virtually clog-free even when airbrushing at low air pressures. It provides adjustable, smooth color results with durable, long-lasting wear whether you airbrush it, apply it by hand with a makeup brush, or create your own ink color palettes with it. The multi-purpose use of RMG and FX Air makes them the essential core color materials for a professional casualty simulation arts makeup kit. Not only do these two products offer you great control in transparency, texture, and color intensity when replicating an injury, but they will retain continuity in all-day wear with very little or no reset time. Another great feature is that they can be used together in an application. RMG can easily be used on top of FX Air if desired, as you will see demonstrated in this video. Graftobian has created an essential group of core casualty colors for casualty simulation in RMG and available in 3 convenient wheels known as the Trauma Trio. These wheels make for handy access and storage, and the colors are also available in single-color half-ounce pots. Let's get started by first demonstrating the proper use of the RMG product. Always transfer an amount of color from the container with a clean palette knife to a work surface, such as the Graftobian stainless steel mixing palette. This method also helps to avoid any risk of cross-contamination. Next, soften the RMG cream using friction with a spatula, as shown, so that it thins out the cream into a soft paste consistency, delivering more lifelike trauma simulation color results. To make a wash from the RMG color paste, simply spray a bit of alcohol-based Graftobian airbrush cleansing fluid directly on the paste and mix it down further until it resembles a watercolor type of texture. Using alcohol to thin it down also makes the application more durable and water-resistant in wear. The core Casualty colors are also available in FX Air airbrush makeup. This great formula can be used through an airbrush or squeezed directly from the bottle on a palette and used by hand with a makeup brush. It's also very handy to use like the popular alcohol-activated ink palettes when poured and allowed to dry down in an empty palette, as you will see in this video. FX Air provides a completely waterproof, durable wear color application that lasts all day long, whether you airbrush it or apply it by hand. You can make your own handy portable FX Air ink palettes by pouring individual colors into Graftobian's empty 5-well palettes. Allow them to air dry completely until the liquid portion has evaporated and the pigment remains in a solid form. To activate the color from your FX Air palette, simply add a few drops of FX Air clear diluting fluid onto a selected color surface and mix it down with a brush to create a liquid ink type medium. You can now apply it by brush or sponge, or transfer the liquid color onto a Graftobian stainless steel mixing palette to work from. It's important to have your tools and supplies prepared and organized for time and efficiency during a session of applying Casualty simulation makeup effects. Other tools, such as sponge-type applicators, need a little more hand preparation work to deliver customized control such as color intensity, blending, depth, and finish in the application process for the most realistic-looking trauma results. Soft cosmetic sponges can be pulled or picked apart to create a skin pore textured stamp tool with a pronounced dimpled effect. This removes the square edges that often cause streaking or hard edges in a makeup application, and the results look less realistic. Pulled sponges deliver better control in applying color and texture more transparently so that it appears like it is coming naturally from underneath the skin, the way a real injury looks. With the white cosmetic sponges, simply pluck out small sections about ½ an inch below the square flat edge on the end of the sponge, and do this all around the sponge. Next, pluck off the corners so that the sponge takes on a rounded look. Finish by plucking out bits of sponge's flat end so that it resembles a pronounced dimpled effect. The end result is a sponge stamp with an end that resembles skin texture. Graftobian's uniquely shaped Glamour Grip sponge is also useful as a skin-textured stamp tool and prepared in the same way as the white cosmetic sponge. Since this sponge is completely curved without angles, you get a very nice rounded and soft skin stamp effect. Before using the plucked Glamour Grip, wet the sponge completely through with water first, then squeeze out any excess so it remains damp. It should look enlarged and feel softer to the touch before using it to apply makeup. Graftobian black stipple sponges can be rounded by eliminating the flat edges and corners to deliver more control in creating fine detail work, such as capillary bursts in a black eye portrayal, or creating softer abrasions. Cut the rectangular-shaped sponge in half so you have two. With one piece and the Graftobian 7-inch stainless steel scissors number 88450SS, begin to roll the sponge slowly in your fingers while lightly trimming off the angles and pointed edges. For more pronounced abrasion effects with wet products, such as Graftobian stage blood products, leave the sponge angles or corners intact. Graftobian red rubber rounds and natural sea sponges are great to use for many kinds of skin texturing and color stippling, or creating slight skin impressions on prosthetic materials such as wax or gelatin. Red rubber rounds can also be used wet or dry, and you can customize the size and shape by cutting or trimming them in sections. Cut the red rubber round sponge in half so you have two. With one half and Graftobian 7-inch stainless steel scissors, begin to round the sponge texture by trimming off any angles. Using the sponge this way is great for achieving smooth, non-linear stippling results in your makeup application. With the other half, use a pair of tweezers to pluck out bits of the sponge that will result in an irregular pitted texture. Using the sponge in this style is great for organic-looking, small skin texturing effects. Graftobian natural sea sponges can be used wet or dry depending on the end result you are looking for. All sea sponges are organic, so they are never the same size or configuration. They can also be cut with scissors or torn apart to create even more interesting surface textures to work with. They possess unique surface patterns that are ideal in achieving irregular makeup patterns, texturing, or blending colors when used in a stippling or dabbing motion.
Casualty simulation makeup applications that are handled or exposed to heat, moisture, or friction can possibly degrade during the training conditions if not protected. It is very important that the initial makeup application remain color consistent, friction resistant, and waterproof in wear, especially with prosthetics. You don't want to take away from valuable training time by stopping to repair or reapply makeup. Incorporating finishing products that set, seal, and waterproof during the injury application process helps to eliminate the need for redoing or touching up makeup during the training in progress.
Graftobian has the perfect setting, sealing, and waterproofing products that will protect makeup from degrading on actor role players and human patient simulators when they are undergoing repetitive motions, being handled for bandaging, or coming into contact with a source of friction. This is especially important if using gelatin or wax-based applications in hot, humid, or moisture-compromising conditions. Graftobian translucent powders can be used to set and seal makeup and appliances, or to remove any residual tackiness before proceeding to the next step in a makeup application process. Always apply powders with a fan brush, such as Graftobian No. 6 fan brush. This ensures the lightest application possible without heavy powder residue. You can also use the brush alone to dust away any powder excess. Liquid sealing and setting products, such as Graftobian's mixing and lining liquid, setting spray, FX Air clear diluting fluid, flexible wax sealer, pro adhesive, and clear liquid latex, can be incorporated in the injury creation process as sealers or finishers, as you will see demonstrated throughout this video. Most importantly, these products will ensure the makeup results will be durable in wear with long-lasting results.
Casualty simulation arts injury reproduction starts with an understanding of a basic vocabulary of medical trauma as commonly used in pre-hospital triage care. Using the correct words and terminology will help you get a better search result in reference books, internet sites, and for further information and actual injury photos. Research will also give you a better understanding of actions and results in mechanism of injury and their wounding impact on human anatomy and physiology. These are important elements in creating accurate and realistic looking trauma scenarios. Shock and cyanosis is a marked deterioration in the body functions as the body's compensatory mechanisms begin to fail. Skin tone becomes pale and ashen as blood oxygen levels drop. Blood vessels constrict and pull away moisture from the epidermis, causing diaphoresis, also known as perspiration. The tissues around the eyes begin to redden and shrink. Advancing shock and hypoxia lead to cyanosis due to the lack of oxygenated blood to the organs and skin. Body extremities begin to develop a subtle blue hue with redness in the eye tissues. Creating a realistic look of advancing shock and cyanosis with casualty simulations, that are consistent with multi-systems traumas provide for a more dynamic triage engagement in a training exercise or mass casualty drill.
Creating ultra-realistic trauma effects in makeup, such as shock, cyanosis, and diaphoresis, are considered benchmark skills in casualty simulation applied arts. The key to visual believability is applying color in such a way that it creates the look of a real-time trauma condition indicating rapidly deteriorating vital signs. This means applying the makeup transparently and building the color slightly in areas, yet retaining some of the natural skin tone in other areas. The results are like a modeling effect on the skin and are realistic to the actual trauma. To prepare and apply a realistic-looking shock effect, you will need a selection of RMG in light cream, corpse flesh, and Frankie gray from Graftobian's Casualty Simulation Trauma Trio RMG makeup wheels or single-color half-ounce pots. The color you select will depend on the depth of color in the subject's actual skin tone you are working with in order for the shock effect to show properly. You will also need Thunder Gray and Red RMG for the detail work. Transfer the selected shock color onto the Graftobian stainless steel palette with Graftobian's 3-inch bent wooden handle spatula number 88457. Friction it down to a soft paste as previously demonstrated in this video. Spray a small amount of Graftobian airbrush cleansing fluid on the softened RMG and mix it down further to achieve a translucent wash consistency. Next, spray a prepared dimpled cosmetic sponge wedge with water to fully moisten it until damp. It should result in a softer and more expanded surface. Take up some of the RMG color wash on the sponge and tap it lightly on a paper towel to check the intensity and sponge patterning and to remove any excess. Doing this helps to achieve the smoothest and lightest touch in your application. For a comparison in before and after results, we are going to apply shock to just one side of the face. Apply the color transparently in a very light stippling motion. Use large, slightly overlapping circles so that some skin will remain free of the makeup. This allows some of the natural skin tone to show through to resemble an advancing trauma. Make sure you apply the color well into the hairline, around the eyes, around the ears, and wherever there is visible skin showing. Next, take some Graftobian translucent powder with a number 6 fan brush and lightly dust over the makeup to set it. Be sure to brush away any excess. Take a small amount of Thunder Gray RMG and soften it down in the same manner as you worked the RMG previously, but this time omit thinning it down with airbrush cleansing fluid as we are using this color near the eyes. Pour some Graftobian mixing and lining liquid into a Graftobian disposable mixing tray, number RMBLISB04. Dip a Graftobian number 4 flat brush, 88404, into the liquid first and mix the brush into a bit of the softened Thunder Gray RMG. Lightly trace the gray color around the eyes, following the natural creases and shape of the eye, and into the hollow of the inner corner. Be careful not to overdo the gray, as the effect should look like a visible loss of normal skin tone, and the skin appears more transparent around the eyes. Next, trace some around the outer crease of the nostrils and around the nose tip. Apply a touch of the gray just to the outside of the ears, on the ear lobes, and very lightly on the lips, just enough to take down the natural pinkish tone of these extremities. Next, take some Graftobian translucent powder with a number 6 fan brush and lightly dust over the makeup to set it, brushing away any excess. For added dynamic realism, we are going to apply a faint tracing of red around the eyes to portray an irritated, shrunken tissue look. Soften down a very small amount of red RMG to a soft paste, but do not add any airbrush cleansing fluid or mixing and lining liquid to it. Take up a very faint amount of the red on a Graftobian No. 2 flat brush, 88402, and lightly trace a thin line as close to the lashes as possible. Do this on top of the lower lashes as shown. Take a cotton swab and blend the color down into the skin so it looks like a natural effect. To set the shock makeup application for waterproof, durable wear, take a fully moistened Glamour Grip sponge and dip it into Graftobian setting spray. Tap it very lightly onto the finished makeup, just enough to seal it. This also helps to eliminate any remaining translucent powder residue. For organic realism consistent with a shock or cyanosis trauma, we will simulate the look of diaphoresis, which is profuse sweating. Mix 3 parts of Graftobian liquid pain and sorrow with 1 part water in a spray bottle. Spray only the areas of the face that would realistically show perspiration, such as the forehead, tops of cheeks, and across the upper lip as shown. Keep in mind that the closer you place the spray to the skin, the larger the perspiration beads will be. The further away you spray the skin, the smaller the beads. For a comparison in before and after results, we are going to apply a cyanotic makeup to just one side of the face. Select FX Air Airbrush Makeup in Blithe Spirit and Red and Thunder Gray RMG that was previously prepared and used with the shock trauma. Place just a few drops of color in the airbrush cup. Pull the airbrush trigger back slightly to open the nozzle and check the color flow on a paper towel as shown. You want to be certain to have a smooth airstream to work with before spraying your subject. Begin to apply the color very transparently by moving your airbrush motion in small overlapping circles as shown so that some skin will show through the makeup. Allowing some of the natural skin tone to show through gives the look of an advancing trauma. Make certain you apply the color into the hairline and around the ears and wherever there is visible skin showing. Any natural pinkness in skin should not be evident to the eye with this look. There is no need to powder this application as it instantly dries upon contact with skin into a waterproof and rub-proof application. Next, take a Graftobian No. 6 filbert brush, 78081, and dip your brush into the previously poured tray of mixing and lining liquid. Take up a bit of the previously softened Thunder Gray RMG and mix it with the liquid on the brush. RMG works extremely well over an FX Air application as the two product textures are very compatible in color, coverage, texture, and finish. Trace the gray color around the eyes as done previously, but make it a bit more pronounced in the natural crease of the eye, inner corners, around the outer edge of the nostrils, and around the nose tip. Apply the gray to the outside and inside of the ears and on the ear lobes. Fingernail beds and tips of fingers will also need an application as extremities are affected in the signs of cyanosis. Next, take some Graftobian translucent powder with a No. 6 fan brush and lightly dust over the gray makeup to set it, brushing away any excess. Using a Graftobian No. 2 flat brush, 88402, add some red RMG, traced in on the upper lash line and on top of the lower lashes as previously shown in the shock makeup application segment. Take a cotton swab and blend the color down into the skin so it looks like a natural effect. Finish this look by applying the diaphoresis effect as previously shown in the shock makeup application segment.
To simulate a fresh contusion that is realistically engaging requires understanding in what causes bruising. Contusions result from a blunt trauma impact to a body area which causes internal bleeding below the skin surface. The point of impact on soft tissue creates broken capillaries, and the body's response is skin irritation, swelling on the surface area due to capillary spillage underneath. As the blood coagulates and clotting occurs, the bruise begins to turn more purplish in color. As the body heals over time, the contusion follows a discernible pattern of color changes as it reabsorbs the blood and fluids related to the trauma.
Applying a real-to-the-eye fresh contusion is an art and skill that takes some practice, but is worth the realistic results. Here, we will portray a generalized reaction to a fresh impact to the cheekbone and brow bone region around the eye. The point of impact is blanched, and the surrounding area is mostly red from broken capillaries with some purplish tones beginning to fill in as the blood coagulates. You will need RMG in maroon, deep purple, and deep yellow. Determine the point of impact, which in this case is the top of the cheekbone. You want to be sure to leave that area free of any color application. Hold your fingers there and put a slight dusting of translucent powder with a number 6 fan brush around them, creating a workaround template that will be helpful during the color stippling process. Transfer the maroon color onto the palette with the spatula and soften it down in the same manner as you worked the RMG previously. Omit spraying it with airbrush cleansing fluid, as you will be working with it as a softened paste. You will also need a black stipple sponge prepared as previously demonstrated in this video. Load one end of the stipple sponge with the maroon RMG color. Lightly tap it once on a paper towel to correct for texture and consistency. Place 5 strategic imprints of color around the point of impact as shown. This should include the outer corner of the eye, the brow bone, part of the eyelid, and 2 small areas under the impact area. Using this method helps you minimize applying too much color, thereby risking a hard edge and a heavy-colored makeup look. The imprints should appear as capillary-like stipple marks left in the skin. Next, hold a wet paper towel or makeup wipe in one hand. Wipe your blending fingers on it to moisten them. With moistened fingers, begin to tap out some of the color in a broken, irregular pattern so it begins to look like it is redness coming from underneath the skin. Keep some stippled capillary marks intact, as they help portray a fresh bruise. Make sure you fade off the color edges to avoid a hard-looking contrast to the skin. Make sure to avoid the powdered area of impact as you work the color. Wipe and re-moisten fingers frequently between each area as you blend and tap out this look. Dry fingers can end up smearing the makeup. Go slowly and carefully so your blending technique allows some skin tone to show through in some areas. The color should look blotchy with uneven patterning and edges fading off. This will help make it look like the color is coming from beneath the skin like a real bruise. If you have too much color in some areas, you can continue to tap and blend it out with moist fingers while keeping all edges very irregular and faded out. When you are satisfied, lightly dust this application with translucent powder on a number 6 fan brush, dusting away any excess. Next, create depth with a slightly coagulated blood look using deep purple RMG, also prepared as a paste. Load the other end of the previously used black stipple sponge with the deep purple color. Place 3 stipple imprints in areas that will help give dimensional contrast. Use the same wet and wipe technique with your fingers, as previously shown, as you tap this color down. To finish this look, prepare some deep yellow RMG in a wash. Take a number 5/0 fine detail brush, 94051, and faintly trace this around the outside edge of the blanched skin area to give it a third dimension. Smooth it out with a cotton swab if needed. Lightly dust this application with translucent powder on a No. 6 fan brush, dusting away any excess. Once the bruise look is completed, take a water-moistened Glamour Grip sponge and spray it with Graftobian setting spray. Tap it lightly onto the makeup to further seal the application. Next, take a tiny bit of Graftobian Liquid Pain and Sorrow on your finger or a sponge tip applicator, 78054, and tap that onto the blanched area of the impact. Feather it out into the areas around it, including part of the eyelid. This gives the contusion the appropriate shiner, swollen skin look for that truly realistic-looking dimension. Lastly, apply a bit of deep maroon RMG with Graftobian No. 2 flat brush, 88402, along the lower lash line to emphasize blood pooling in the tissues under the eye.
Lacerations are cuts and gashes that break open the skin as a result from various impacts to the body. They can be superficial, involving just the top layers of skin, or very penetrating to the bone and muscle. They can look very jagged like torn flesh, or they can look evenly incised like a surgical cut. They can also contain avulsions, which are skin flap formations caused by tearing away of skin from the impact. Abrasions are more like scrapes, such as road rash, where skin is scratched down by friction against a hard surface, leaving bits of torn flesh. In trauma training that involves crashes, blasts, or other mechanisms of impact to the body, it would be visually correct to include cuts and scrapes that are consistent with the simulation scenario.
An easy and quick way to portray simple lacerations is with Graftobian lining pencils. Here, we will demonstrate a laceration through the brow. Select a black, red, and white pencil for this effect. Make sure they are freshly sharpened to a fine point for best results. First, lay down a faint red irritated skin area with some prepared red RMG in a wash. With a wet prepared sponge, stipple this on the forehead and brow bone area where you will be creating the laceration. Lightly dust this application with translucent powder on a No. 6 fan brush. Next, trace an irregular line with the red pencil directly on the skin and down through the eyebrow as shown. Take the black pencil and trace it right next to the red with a bit of overlap on the red. If the black is too stark, simply take a swab and blend it down. With the white pencil, trace a faint line down the other side of the red, taking care not to mix it into the red line. Put a thin layer of Graftobian's Pro adhesive over these pencil lines as shown and allow to dry completely. Next, take a No. 5/0 fine detail brush, 94051, and dip it into a bit of Graftobian FX blood powder. Press this down the middle of the pencil laceration. You can also slightly moisten the brush, work up the blood powder into a tiny bit of paste, and apply that down the pencil line for a deeper-looking coagulated effect. To finish, add touches of Graftobian blood gel to give it a fresh injury effect. Spray the laceration with a tiny bit of water so it will bleed like a fresh wound. Another great method of applying a durable wear laceration is from your FX Air ink palette. Here we will demonstrate a split lip laceration. Prepare some red, clotted red, and deep purple FX Air from the palette as demonstrated previously in this video. Lay down a red irritation field in the area with the red color as shown. Paint a layer of Graftobian Pro adhesive in the area where you will draw the laceration line through the lips, extending above and below the lip line, and allow it to dry completely. Powder this with a bit of translucent powder on a number 6 fan brush. With a number 5/0 fine detail brush, 94051, take up some of the prepared FX Air clotted red and draw a line on top of the sealed line, keeping the line very thin and believable. Take some FX Air Deep Purple and stroke in some very slight contrast. Don't overdo the purple, just enough for depth. Next, lightly add some red just around the split lip to give it dimension. Lastly, dress the split with a tad bit of blood paste to give it the appearance of an open wound. Abrasions are also frequently seen in impact injuries, and there are a number of quick and easy ways to create scrapes, grazes, and road rash effects. One way is to take the side of a flat mixing spatula and load it with Graftobian blood paste. Draw the loaded product edge over the skin in short or long strokes as shown. Another method is with an unprepared black stipple sponge that has been loaded with Graftobian blood paste and quickly drawn across the skin in short strokes as shown. Load the stipple sponge with Graftobian blood gel, and you can make abrasions that will have a weeping blood effect. We suggest experimenting with these products and techniques to get the best results you are looking for. Avulsed abrasions can be made by spreading latex on a skin area to be distressed. Brush on an amount of Graftobian's clear liquid latex in the direction of the abrasion. While it is drying, rough up the surface slightly by rubbing it over with a modeling tool, so it results in the look of torn flesh. With a number 5/0 fine detail brush, apply some prepared clotted red RMG paste into the grooved areas of the abrasion. Add some contrast around the outer edges with blood blister RMG paste. Add some debris texture with Graftobian ash or soot powders or a mixture of both. With the red RMG previously prepared as a wash, create a slight irritation field around it to give it a slightly swelled dimension. Apply touches of Graftobian stage blood for an active bleeding effect.
Open wound traumas on the body can result from a variety of injury mechanisms, including compounding injuries, such as punctures, deep penetrating wounds, impalements, skull fractures with open cranial gashes, abdominal eviscerations, and partial or full amputations. These kinds of trauma are consistent with crash and blast or explosion training scenarios and are often core simulations used with actors or patient simulators.
In this demonstration, we will use Graftobian modeling wax to create a skull fracture with an open cranial gash along with some deep facial slashes. Begin by using a white Graftobian lining pencil to define the shape and placement of your gash and slashes as shown. Trace the cranial gash with the pencil on the forehead. Take it up into the hairline, making an irregular shape to indicate the impact. Next, trace some facial slashes below, along the side of the head in the cheek area. With red RMG prepared as a wash, put down an irritation field in the areas around the penciled lines. Stipple a thin coat of Graftobian setting spray with a sponge over the irritation field. You can alternately choose to use red FX Air prepared from your ink palette to apply the irritation field and omit the step of applying the setting spray. Take some clotted red RMG prepared as a paste and apply this with a number 4 flat brush, 88404, inside the white lines as shown. Next, apply Graftobian spirit gum with a sponge tip applicator, 78054, on top of the pencil lines of the gash. Press a small amount of cotton into the spirit gum and then pull away, leaving some thin wispy threads embedded in the spirit gum. Modeling wax adheres a bit stronger to cotton-textured spirit gum. However, you can choose to omit the cotton step and just tap the spirit gum with your finger to thicken the texture. Use Graftobian modeling wax in either light flesh or medium brown, whichever is closest to the subject's skin tone. Scoop a small amount out of the container with a double-ended spatula sculpting tool. Modeling wax colors can be blended together if desired to create more customized skin tones. Knead the wax with your fingers until softened. Next, shape it into a roll, long and thick enough to place along the outline of the cranial gash. Press the wax rope onto the cottoned spirit gum and begin to blend and contour the wax with your fingers or use the smooth end of a wooden modeling tool. Make sure the edges of the wax are blended down and feathered out on the skin for a completely natural look, as shown. Use a very small amount of Graftobian makeup remover on your fingers and the modeling tool to eliminate any stickiness and for the final blending and finishing. Blot down the wax with a swab dipped in airbrush cleansing fluid to remove any remaining makeup remover residue. Next, take some Graftobian bone wax scooped from the jar. Work it with your fingers and press some bits of it inside the gash and next to the hairline. This indicates skull fracture bone bits to portray a more complex injury simulation. Apply wax sealer to both wax applications as shown, down and around the areas of the wax. For faster application, you can use a larger brush, such as the number 10 Filbert brush, 78083. With black RMG prepared as a paste, use a number 2 flat brush, 88402, and paint that just in the center of the wound to portray depth. With blood blister RMG also prepared as a paste, paint that lightly around the black RMG. Lightly dust both applications with translucent powder and the number 6 fan brush. With prepared maroon color in RMG as a wash, or from the FX Air ink palette, add some light shading around the wax base to enhance the swelling effect. Next, take some Graftobian blood paste and place just a bit inside the gash and on some of the pronounced edges. Finish this injury with a good amount of Graftobian stage blood, as open skull fracture traumas bleed profusely. This should be applied only when the subject is in place for the exercise, so you achieve the proper blood flow direction for the injury simulation. Continue on to the slash marks you made earlier with the white pencil. Apply Graftobian spirit gum with sponge tip applicator 78054 along the pencil lines. You can add some cotton wisps as done previously, or just tap it directly until it thickens. Prepare small pieces of skin tone modeling wax, softening them with your fingers. Build one side of the slash by smearing the wax down over the spirit gum with a flat mixing spatula. Apply wax to the other side of the slash in the same way. Do the remaining slash in the same manner by smearing wax down over the spirit gum on each side. Prepare a wooden modeling tool with a bit of Graftobian makeup remover on it. Begin to blend down the wax on the outer edge on the skin as shown and feather out the edges on the skin. Do the same on the other side of the slash. The end result should look like irregular parallel skin flaps facing down the middle of the slash to show significantly avulsed skin. Open the flaps a bit with the modeling tool so the skin is exposed. Seal the wax application with wax sealer applied with a number 10 filbert brush 78083. Take a small amount of prepared black RMG paste on a number 2 flat brush, 88402, and paint that just in the center of the wound. Take a small amount of prepared blood blister RMG paste and paint that around the black, carefully bringing some of it inside the flaps and a bit on the sides. With prepared red RMG paste, stipple lightly over the wax and skin area to bring in some natural-looking redness in skin. Prepare some deep purple RMG paste and lay in some slight bruising color highlights as shown. Lightly dust this application with translucent powder on a number 6 fan brush. Add some Graftobian blood gel for the active bleeding effect. For added realism, apply some environmental debris, such as cosmetic dirt. For this, we combined Graftobian black soot and ash dust and applied the mixture as part of the debris from the impact. You can also apply Graftobian stage blood, but for best results, it should only be applied when the subject is in place to achieve the proper blood flow direction for the injury simulation.
A fracture is a break in the continuity of any bone in the body. Simulated bone fractures focus on trauma that results from high force impact or stress-induced injury to the body. There are 2 basic types of primary fracture classifications: simple and compound. A simple fracture is a closed injury that occurs as a complete, incomplete, or displaced split of the bone without penetrating through the skin surface. It is marked with swelling, bruising, and internal bleeding. A compound fracture results when high force impact to the body causes a displaced bone to break open and protrude through the skin at the fracture site. It produces considerable soft tissue damage surrounding the fracture, including swelling, bruising, and in some cases profuse bleeding, along with marked symptoms of shock and diaphoresis.
Making a bone fracture is as simple and quick as molding cotton and latex together. Make these the day before you need them to allow time to dry completely. With gloved hands, pour an amount of white-colored latex over a section of cotton as shown. Use just enough latex to thoroughly moisten the cotton to a moldable structure. With your gloved fingers, form and shape the cotton into a small broken bone fragment, making sure the base of the bone is at a 45-degree angle. Set aside to dry thoroughly before use. When dry, seal the bone with setting spray or wax sealer. When the sealant layer is dry, powder with translucent powder and dust off any excess. Take a sheet of 2-ply tissue and tear in half as shown. Tear 1/2 of the tissue into 4 pieces. pull all the edges of the 4 pieces so they are jagged, irregular edges. Apply a layer of Graftobian Pro adhesive to the skin in the area where the fracture will be located. Allow to dry until clear. Apply Pro adhesive to the underneath base of the latex bone and allow adhesive to become tacky. Press bone onto the skin area and it will immediately form a secure attachment. Paint a layer of Graftobian clear liquid latex over the side of the bone and the skin area around it to further secure the attachment. Next, lay down one of the 4 pieces of single-ply tissue over the bone as shown and add a layer of clear liquid latex over that as shown. Allow to surface dry. Add another tissue layer and latex and continue in this fashion until all 4 pieces are used. Add a final layer of clear liquid latex to seal this application and allow to surface dry thoroughly. Powder the application with translucent powder on a No. 6 fan brush and dust away any excess. Next, take some Graftobian Moulage Miracle molding medium and build it up around the area in front of the bone, creating an instant appliance that has some torn skin elements. This indicates severe tissue damage from the force of the fracture. Feather out the edges of the paste using fingers or a brush dipped in water so that it smooths and blends down into the skin. To help speed up the surface drying of the molding paste, you can force dry it with a hairdryer. Once the surface of the paste is dry, it will continue to set up, from the outside in, to a firm yet very palpable appliance. For faster application, you can make this appliance ahead of time, allowing it to dry completely, and then attach the skin with Pro adhesive. Once the surface is completely dry, paint a final layer of Pro adhesive over the entire application. Prepare a skin tone color mixed from the RMG Derma wheel in a paste that closely matches the subject's actual skin tone. Tap this color lightly onto the appliance and blend it into the skin as shown. Lightly dust this application with translucent powder on a No. 6 fan brush, then spray the entire application with setting spray. To further emphasize the trauma of an open fracture, create a bruising dimension using either prepared maroon RMG paste or from the FX Air ink palette. Apply a red irritation field all around the fracture and feather it out onto the skin area. Next, take some prepared dark purple RMG paste or from the FX Air ink palette and stipple that in to bring up the bruising dimension. Finish this appliance with some prepared clotted red RMG paste or from the FX Air ink palette and place near the open areas around the fracture as shown. Add some Graftobian blood paste in and around the opening. Once the subject is in place for the exercise, add the proper amount of Graftobian stage blood so you achieve the proper blood flow direction for the simulation.
Burns are caused by contact with thermal heat, radiation, friction, electrical, or chemical agents that result in destruction of skin tissue. Burns are characterized by the degree of tissue damage as well as the severity of exposure. First-degree burns involve the top skin layer, called the epidermis. Appearance is associated with redness, irritation, slight swelling, and may have a mottled red pattern in the skin. Second degree is a deeper damage to the dermis layer, a partial thickness burn with intense reddened, splotchy appearance. It can show a blistering, peeling, or oozing body fluids, known as serous fluid. Third degree is a full thickness burn, destroying all skin layers and results in a loss of skin fluids in those areas. Skin can look charred black and oozing, or it can appear dry and white, depending on the burn agent and length of exposure.
Prepare the red and CVA suntan red RMG colors as a wash or select FX Air Airbrush Makeup in red and CVA Suntan Red. Check the color flow on a paper towel first to be certain you have a smooth airstream. Begin to apply the red color very transparently by moving your airbrushing motion in small overlapping circles as shown. Apply the color into the hairline and wherever there is visible skin showing. The end result should look like the burn is coming from beneath the skin, like the real thing. There is no need to powder this application, as it instantly dries upon contact with skin into a waterproof and rub-proof application. Next, prepare CVA Suntan Red RMG as a wash. Take another prepared dimpled cosmetic sponge or glamour grip and dampen with water. Take up some of the color on the sponge and blot it slightly on a paper towel to take away excess. Stipple this color in just a few areas to bring in contrast, as shown. The most prominent parts of the face, such as the forehead, nose, top of cheeks, and point of chin, will be a bit darker because these areas take the greatest amount of sun exposure. Keep this color very light and randomly placed so that it gives the burn a mottled, blotchy effect along with a look of slight swelling. For this trauma, you will need to pre-make some blisters in various sizes and well ahead of use. We've designed two methods. The first, using duo-lash adhesive by squeezing the adhesive out in various size mounds on a mixing palette and allow to dry. Powder them before lifting them off the palette. The second method is using melted clear gelatin to create blister mounds by dripping liquid gelatin from the spout and allowing them to cool completely to a firm set. Powder them before lifting them off the palette. Prepare red RMG as a wash. With a moistened dimpled sponge, lay down a second-degree burn field that is more intense in color than the previously done first-degree burn. Be sure to gradate the application out into a first-degree area around it so it transitions smoothly from second to first degree. Next, add more modeling contrast with CVA Suntan Red RMG prepared as a wash and stippled in with a prepared sponge. Next, add some depth to the burn by stippling in just a few and very slight touches of dark purple RMG prepared as a wash. Once these colors are complete, seal the entire application with setting spray and allow to dry. Select some blister shapes and paint the bottoms of them with clear liquid latex, spirit gum, or pro adhesive. Press them onto various areas on the reddened skin and allow to set up. Next, stipple a thin layer of clear liquid latex with a sponge over the blisters and on a few areas of the reddened skin as shown. Let dry and powder the latex application with a light dusting of translucent powder on a No. 6 fan brush. Next, take some prepared RMG maroon as a paste and slightly tint some areas on the base of the intact blisters. Alternate the tinting of just a few of the blisters and enough to bring up the look of depth and soreness. Using the tip of your modeling tool or tweezers, tear open the latex in areas that indicate popped blisters and peeling skin, as shown. With a bit of prepared red RMG as a paste, use a No. 2 flat brush, 88402, and apply the color lightly into the holes of the torn latex. With prepared RMG dark purple wash on a brush, add a trace amount of it in the popped blister holes and a tiny bit around a few of the intact blisters to complete the trauma. Powder over the blisters with a light dusting of translucent powder on a No. 6 fan brush. For the third-degree burn, we are going to work with the first-degree burn we did previously and build it into a third-degree effect. If you are starting from the beginning, you will need to apply a first-degree burn field over the entire skin area where you will be applying the third degree. For an enhanced effect of a third-degree burn, apply some Topstick clear medical adhesive tape and place it on the areas of skin to portray a slight disfigurement effect as shown. Apply a very light layer of pro-adhesive to the third-degree area where you will apply the gelatin, including the Topstick application areas. Let dry. Next, take some pulled cotton sections and arrange them on the face as you press them into the adhesive layer. This will help give the gelatin better structure and depth in sculpting the charred skin look. Melt Graftobian FX gelatin in either the flesh or clear color according to the bottle directions. Keep the melted gelatin bottle in a pot of hot water so it remains liquid during use. With a 3-inch bent wooden handle spatula, apply the liquid gelatin mixture to the entire area, making sure to cover over the cotton and the areas where the Topstick has been applied. With a modeling tool, shape the gelatin mixture to create deep hollows and higher peaks, along with some texture that would suggest exposed face muscles and burnt flesh peeling away. Extend the gelatin edge beyond the cotton and make sure the edges of the burn are thinly blended out onto the skin. Work quickly, as gelatin will begin to set up fairly fast. Next, paint the entire gelatin appliance with a layer of clear liquid latex. The latex layer will encapsulate the gelatin and help make it more waterproof and durable in wear. Allow to dry. Powder the entire appliance with translucent powder on a No. 6 fan brush. Take some prepared clotted red RMG as a paste and apply this with a No. 6 filbert brush into and up the sides of the pits and holes in the gelatin appliance. Add some slight touches of the clotted red to a few of the deepest areas of the appliance. Use the clotted red to blend out any of the second and first degree burn areas if needed. With prepared deep yellow RMG as a wash, apply this color with a damp sponge and highlight the fleshy spots of the burn where the white color of the cotton may be evident. Use it sparingly, just enough to tint down the whiteness of the cotton. Now add the charred effects with Graftobian color spray in black. Hold it about 12 to 15 inches away from the appliance and aim at the highest peak areas. Spray in short bursts to keep the spray under control. Spray some out on the skin as shown to blend some of this effect with the burn. Alternately, you can also use FX Air in black through the airbrush to achieve a more controlled charred effect application. You can also use Graftobian ash powder or mix black soot with ash powder for even more interesting charred effects. Take some Battlefield Explosion Gel on a sponge and stipple this over the high points of the appliance and around the edges of it, also stippling it out onto the skin area as shown. This gives greater depth and action to the third-degree burn effect. For a more dry and shriveled textured burn effect, omit the Battlefield Explosion Gel and dip a No. 6 fan brush into Graftobian black soot. Apply sparingly to the blackened areas to build the texture where you need it. Finally, take some Graftobian blood paste and apply very small, sparing amounts into a few of the holes and pits, taking care not to overdo the effect.